It's been on for 15 minutes.
I'm very sorry. I don't think
I
anyone...
can't reach my drink.
Here, we can move this table closer for you.
Oh, that's great.
Is that better for you?
Oh, yeah.
Okay, good. All right. Can you tell me your name and date of birth?
Ethan Dillard, 4/16/97.
Awesome. So my name's Amy. I'm going to be your student nurse today. I'm here to talk to you about sickness and diabetes management. I noticed in your chart that you seem to have a little bit of sickness going on. Can you tell me about that?
Yeah, my feet hurt.
What about your feet hurt?
They hurt all the time.
Okay. Have you had any cough or runny nose or any feelings of like a cold lately?
Only when I'm in the bathtub.
Only when you're in the bathtub? Okay. Have you had any nausea or vomiting?
Every now and then.
Every now and then? Okay. Do you monitor your glucose levels regularly?
I
like
check them every Tuesday.
Every Tuesday? Okay. So you don't check them before and after meals?
No, am I supposed to?
Yes, you are. It's very important to monitor your glucose levels because if you only check them once a week, then your levels could be out of whack, which would put you at risk for many complications.
How often should I check them?
You should check them every day, multiple times a day, especially before and after meals.
That's a lot.
Yeah. You want to make sure that you're monitoring them well, especially when you're sick. We want to make sure that you keep your levels up, especially if you've been vomiting or had any type of diarrhea, because you're depleting your sugar when you have those symptoms. So
that makes sense.
yes, it does. Okay. So do you have any questions for me?
No.
Okay. You need to make sure you're drinking lots of fluids too. So that's awesome. Have you been able to keep any down?
Mm-hmm.
Good, okay, and you also need to make sure you're taking your insulin regularly still. So if you're having trouble taking that while you're sick, we just need to make sure that you're still getting your insulin and you're still checking your sugar levels. And if you're not able to eat, we need to make sure we have a supplement of some type of, maybe have to be a food bolus or something like that, to some nutritional supplements.
I don't want that.
Okay, well there's several options available, so we could talk about those at a later date if we need to, but as long as you're able to eat and drink plenty of fluids, then you should be fine. And we definitely need to make sure we're checking those sugar levels like we should be.
Alright.
So before and after meals, make sure you're checking them, okay?
Yes, ma'am.
Alright, that sounds great. You have any questions for me?
No.
Okay, well you have a good day, Mr. Dillard.
Hello.
I'm Jasmine. I'll be your doctor today.
Okay.
What's your name and date of birth?
Ethan Dillard, 4/16/97.
Okay. How are you doing today?
I feel alright.
Okay. I see that you have a surgery scheduled in 2 days and knee surgery.
Mm-hmm.
And I came to talk to you about your diabetes because I see that you also have diabetes and it's important to get that under control before your surgery.
What does diabetes have to do with surgery?
It can impair your wound healing and it can make it take longer for your wound to heal. And also, it can increase your risk of infection. So it's important.
I didn't know that.
Yes. So it's important to check for signs of infection, so like redness around the incision site, drainage, pain, and things like that. And it also, it can affect your electrolytes. So it's just important, like if you feel any different, just let someone know. And you should also make sure that you're really monitoring your blood sugar. So check it every 3 hours and just get it under control before your surgery. I see that you're taking metformin. It's important to stop taking that 48 hours before your surgery because it can cause lactic acidosis. So basically it can just lead to like muscle cramps and pain, and you don't want that.
Okay.
And it's also important for we might suggest that you stop taking your insulin. It's important to follow the rules. Make sure you're not eating before your surgery because it can cause your blood sugar to be high, and we need that to be under control. Did you have any questions?
I think that's it.
That's it? Nothing? Okay.